Hello, welcome to my first fish disease case about ick or white spot disease. Well, let's start with this most common fish disease and in effect one which is very easy to find by a microscopic dissection and observation. Here we see the few white spots on ick or on Cynoglossus, also called tongue or sole. See the few spots here on the body. Fish are still pretty healthy, moving well, but if you use in your aquarium or fish tank some extra light like from the flashlight, you can observe much easier the white spots on the body of the fish. This helps you to detect the parasite much faster, which is very important because you have to treat as soon as possible in the first stages of the disease. And if you take a skin smear, here we see at 100 magnification the white spots as parasites moving around. If you know that those are parasites and they're moving around, they're causing damage, they're causing lesions. So they might make little holes in the skin of the fish and the mucus, so a possibility of secondary bacterial infections might occur. For the treatment of ick, like here on this sole, the first thing we always say, treat as soon as possible. And, like here on the bottom, avoid the spreading. Make sure you work biosecure, that the nets you use in that fish tank are not used on other fish tanks, and that you keep the water and the fish separate from other fish, until you're sure that the fish are treated well and free of disease. I can recommend that you raise the temperature with a few degrees Celsius, so you speed up the life cycle of the parasite. And then the baby tomites come out, and they are easier to kill with the medication that you normally apply in the aquarium. We recommend, mostly for anti-ick medication, malachite green, or a similar product like Vanamor from Aquarium Munster. And treat for a minimum to 7 to 14 days, like the brochure will tell you with the medication that you bought. I can recommend to siphon off the bottom 2 times a day to remove the adult white spots, because they go on the bottom. If secondary bacterial infections occur or appear, try to treat accordingly with an antibacterial medication like pheraltadone or nitrofurazone or a similar drug, because this can happen after the lesions caused by the parasites, so you have to have 2 medications ready. We also recommend the feeding for 10 to 14 days with our Dr. Bassleer biofish food Matrine, and this helps the fish to fight off the parasites so they don't reinfect or they fall off, and also it helps the immune system of the fish so the fish becomes much stronger. So these are some advices I can give you for this case. If you want to learn more about ick, I have also a YouTube tutorial number 6 available at my YouTube channel. Here is the link of that video, which explains you more about the white spots Ichthyophthirius and what you can do about it. I hope you're interested to learn more about other cases coming up here at Patreon. I thank you for your interest.